What's popping, y'all? So today we're gonna be taking a break from the Israel-Hamas conflict to give you some breaking news on what's happening on the Rona front. And so, if you haven't heard from yesterday, basically Pfizer is now doubling the price of Paxlovid as it transitioned out of the pandemic, emergency phase. Now, if you don't know what Paxlovid is, it basically has been, credited by many people for saving so many lives during, the height of the pandemic. And a lot of it is due to not only the fact that it is very effective, but also it was free as the government pretty much paid for it during the pandemic. Now it is not free anymore. We can go to see why. So the price of the life-saving Rovid antiviral medication Paxlovid will more than double as the United States transitions out of the emergency phase of the pandemic. Drug maker Pfizer has announced yesterday. The list price before insurance kicks in will be about $1,400 for a 5 days course. That is 2.6 times higher than the $530 per course price paid by the U.S. government. Now, if you don't know, throughout the pandemic, the U.S. government basically paid for not only just Paxlovid, but basically tests, vaccines, and all that to make it free for people, to lower the barrier of entry for people to actually take these things. Because if you've been living on a rock for the past 4 years, a lot of people really don't believe the severity of Rovid or of long Rovid, and so they will rather not take a vaccine or medication or test if they don't perceive the severity as high, as well as the fact if they gotta pay for it. And so the biggest thing with the US government, they were just like, okay, let's pay for it, make it lower barrier entry. And that really created not only just saving lives, but also get a lot of people who probably wouldn't have taken it for various reasons to actually take it. And so now with this price hike, it now makes it a barrier entry for a lot of people to be able to take this. Pfizer also noted that the list price does not necessarily reflect the price a patient will pay, and said it's working to secure health insurance arrangements that would come with low out-of-pocket costs for patients. Like what I said, the insurance and all that, basically when you think of insurance, when you think of medical services, you don't pay the full price of medical services if you do have insurance. Like you might pay a deductible, then it might turn into a copay, or it might turn into like a percentage pay or something of the services. Basically that is to lower the barrier of entry for people to get medical services. And so in this instance, the company has also said that it will offer assistance with co-pays for people who qualify, in order to lower that barrier entry whenever it comes to trying to take Paxlovid in the next week, because I think that's when the price hike is about to take it in effect. They also said that Medicare and Medicaid beneficiaries or those who are uninsured will be able to get Paxlovid for, okay, that's good, for free through 2024 via patient assistance program, the Department of Health and Human Services has said last week. And Pfizer has said that the program will extend through 2028 for patients who are uninsured or underinsured. This is a good sign because pretty much, like I said, they're trying to make these deals for these insurance companies. But, if we live in a place like Texas, which has the highest uninsured populations in the US, how will people get to medicine? Because let's not act like the pandemic is just over. It's just now people don't fear it as much as they did in the first few years of it. Now, I also remember this past year, vaccines for Rovid basically also increased in price as they went through a similar transition from being government subsidized and paid to now being in the commercial market. And a lot of people, rightfully so, gave a lot of flack for that because it rose to about $115 to $130 depending on where you get it per dose. And a lot of financial experts and big pharma analysts have been saying that we could see a similar, if not worse, price hike for Paxlovid, especially right here when it says it could increase to about $2,500. And of course, the topic's all off. The article says that this is based on the value it provides to patients, providers, healthcare systems due to its important role in helping reduce, COVID, hospitalization, and deaths. Yeah, I mean, it's basic big pharma healthcare. Like, I don't like it. It's just the way our system is. I mean, if we kind of have a national health system where everything is subsidized by the government with taxes and stuff, that's my personal opinion. But yeah, it's just one of those things where, we're still in like a COVID situation where we still need to like have this available readily on hand, and it doesn't bring good news for you to like try to payroll or try to get money off of Paxlovid just yet, maybe 20 years down the line, not 20, 10 years down the line at the very least, when Roe v. is still like, around, but it's like more hopefully seasonal at that point, then we can, talk about having this as like, big pharma, like trying to make money off of it. But we're still in an emergency situation, like, even though people don't think it, like, we shouldn't be doing this. But yeah, this is a quick update for me, one of the shortest videos I've done on this channel. If you like these small formatted videos, please like, subscribe, turn on post notifications, tell me what you want to know, as well as the fact, comment down below anything, you related to this, price hike that you're worried about, as well as any other topics you want me to discuss on the channel. As well, you want to look at some of my other videos I've done in the past week, especially about the Israel-Hamas conflict. Go to these videos right here. But stay warm, stay frosty, depending on what part of the country you're in, and peace out.